November is National Diabetes Awareness Month, and here at Oakland Regional Hospital in Southfield, they held a free diabetes expo where people were able to learn a lot about diabetes. Oakland Regional Hospital opened its doors to community members.
It's a physician-owned hospital where we've got the top, mostly orthopedic, but hand and spine and general surgeons in town who come here and can do their top cases in the way that they want to do it, without any, of the burdens of other health systems. So they bring their top people here and their top cases, and it's a new place. It's different than it was before. It's new ownership, and it's really exploding, as you can see by what's happening here today.
I was going to say, because there's a lot of people here today for this event.
Yes. So one of the things we're doing, because we've changed this whole place, is we're reaching out to the community. Today is a diabetic health expo.
The event included surgeons speaking to the community, along with podiatrists talking about the impacts of diabetes. There are foot screenings here. Why is that so important?
So many people have diabetes and don't know that they have it. Or they may have it but don't know much about it and don't realize how many things it can cause, how it affects the body in so many different systems. Personally, I'm a foot specialist, so I'm concerned in how it affects the foot and their ability to walk and to reduce their risk of developing wounds on their feet that we call ulcers that can lead to infection and potentially ultimately to amputation in bad cases. So we use this as a means of educating people who may have it or may have a family member who has it, or to help let the general public know about the considerations of diabetes.
The doctors examine the patient's feet.
We'll check the basic nerve supply. Can they feel? The majority of people who have diabetes will develop a nerve condition called neuropathy. Neuropathy affects the longer nerves in the body. They don't function as well as they did, primarily with numbness. And if we can't feel, we can't tell if something's wrong.
The main reason they have the screenings
are to determine people who may be at risk, who have a foot deformity or potentially poor circulation or neuropathy. And oftentimes in these simple screenings, we actually find wounds that people didn't even know about.
Representatives from the American Diabetes Association were also on hand for the event.
We are really happy to be here in terms of being able to offer this as a service to the community in reference to American Diabetes Month and being able to promote more enhancement and engagement in terms of prevention, awareness, and management of the disease, and knowing that it is something that is definitely impactful to specific communities, particularly African American and Hispanic communities. We are very delighted to be able to take part in an opportunity to provide resources, do via presentations and the dissemination of literature, help to eradicate this disease and help in terms of being able to offer more supportive services to the community.
And Williams says it's an epidemic.
It's a chronic disease. There are about 30 million people who are impacted and living with diabetes in the United States currently. And out of that, there's a significant population of those individuals who have the disease and don't even know it. And so for us, it's a matter of being able to be intentional in terms of sharing our message in an effort to find a cure. Because without education and without action upon receiving the education, this is a disease that will continue to spread and impact our communities.